Philip has outlined a bit about random drug testing in Victoria. Here's the history of its development in the Australian states. And Victoria was the first, but now all jurisdictions, including the two territories, have a form of random drug testing. And in all jurisdictions, there's essentially a three-stage process. A roadside screening test that's administered to drivers, and those who fail that roadside test have a second screening test, usually done in a more controlled environment, in a van or a bus, or in some cases at a police station. But the second test is also an opportunity to collect oral fluid for laboratory testing, and it's the laboratory testing that is considered to be evidentiary. Here's the preliminary testing device. It's essentially a scrape across the tongue. Then there is the secondary testing device. This is used in most Australian states still at this stage, but Victoria has moved to a different secondary screening device. And I think that's because the previous one was tending to have a number of false negatives. Another characteristic of the program in Victoria is to make use of so-called drug booze buses that combine the former operation of buses for random breath testing with now a clear indication that drug testing is involved as well. And here we see the earlier booze buses, a highly conspicuous operation at the roadside. The officer in the foreground directs traffic into lanes where typically 6 officers do the preliminary testing for alcohol. In the new regime with the combined drug and booze buses, we also have the support of mass media publicity from our Transport Accident Commission, the government injury compensation insurer. So it's not just the visibility of the buses that's relevant, it's also the high level of mass media publicity that accompanies it. This chart shows you the development in random drug testing. The brown line is essentially the number of tests that are conducted in the preliminary sense at the roadside. The red line is the drivers detected from those tests. And then against the background of that is the proportion of drivers who were killed and found to have on board either one of the 3 target drugs, the drugs that tested in the preliminary testing operation, and more importantly, the drivers who were found to have any impairing drug. And you can see that during the period since the random drug testing commenced, that there's been a reversal of trend in both of these indicators. So it's not just the drivers with one of the 3 prescribed drugs who figured less in fatal crashes. In thinking about this area, we started to work on the idea that there's some sort of analogy between random breath testing and the new regime of random drug testing. And initially, most random drug tests were carried out at the booze buses. And the general principle was one of general deterrence of drug driving. In other words, to raise the perceived risk of the illegal driver being caught for the offence, and hence through that deterrence mechanism to discourage getting into that situation in the first place, either by not taking drugs or not driving after consuming drugs. And I think it's generally true, as we found with random breath testing, that these forms of operation aren't really all that effective in detecting illegal drug driving, but they do have a very powerful effect in deterring it. There's been a meta-analysis of random breath testing, putting together many studies. This typically finds that they're very effective, usually reducing alcohol-involved crashes by at least 17%. And the same meta-analysis has found that the methods of random breath testing as practiced in Australia with highly visible bus-based testing and mass media publicity are typically the most effective compared with operations in other places. And of course, we do have targeted alcohol screening using car-based operations, usually intercepting suspect drivers or targeting certain locations and times. And the same meta-analysis has shown these things to be effective, but not as effective as random breath testing. There's still a role, of course, for detecting and targeting drivers with very high levels of BAC, and these problem drink drivers still do exist. And perhaps there's still a case for targeted testing of drugs. We've spent some time thinking about the relationships between enforcement levels and crash outcomes. And again, Rune Elvik has calibrated relationships of this type for all forms of traffic enforcement. Generally what happens is if you increase the amount of enforcement, of course, as you would hope, crashes go down, but there's a point of diminishing returns. And the nature of this relationship is quite like one used by economists in looking at all sorts of investments that reflect diminishing returns. And typically what we find is that in the road safety context, that this sort of relationship holds well, and a measure of the effectiveness is the so-called elasticity of the relationship. In other words, what change or reduction in crashes do you get for a 1% increase in the enforcement? And typically the elasticity is about 0.2 to 0.3, and most forms of traffic enforcement fall in that range. Excuse me. In the random breath test area, over many years, we found that first of all there are minimum levels of random breath testing that are needed. Secondly, that as the program has been increased, elasticities of the typical magnitude that I mentioned before have been found. And in more recent times, we've looked at the situation in one Australian state where the amount of random breath testing has actually been reduced. And you can see here that the number of random breath tests per licensed driver, the blue line, fell dramatically during the 2000s. And the red line, which reflects the total number of preliminary breath tests, including those not at random, has also fallen. And as you would expect, the drink driving problem in that state has become worse, quite substantially so. And we found that we could look at this type of connection between the amount of random breath testing and drink driving in fatal crashes, and see again the same forms of diminishing returns type relationships, again with a elasticity of about 0.2. So turning now to this chart again, what we thought we'd look at was the connection between the proportion of drivers killed with either all drugs or with the 3 targeted drugs as a function of the amount of total testing being carried out. And you can see here quite a neat relationship, that in the case of the targeted drugs, the lower line, there's a suggestion of a diminishing returns relationship. But when you come to all drivers with any form of impairing drug, the relationship is quite strong. And in the case of the of each of those relationships, the elasticities are in that range between 0.25 and 0.3. So that allowed us to turn to the question: what is the benefit cost of investing in random drug testing? And in the Australian state of Victoria, of Western Australia, I'm sorry, we were able to get good data on what this means. And you can see that the preliminary device in this period was of the order of $38. I think it's slightly more now. But only about 6% of drivers go on to the secondary tester, and only a proportion of those go on to laboratory analysis. There's, of course, the officer's time at the roadside. Typically, he needs to attend the testing for at least 6 minutes, and that is quite a substantial cost in the scheme of things. But overall, our estimate was that there would be a cost of about $143 per random drug test when all those factors are taken into account. Thank you. So looking at this relationship, and in this occasion we focused on the reduction in killed drivers with any impairing drug as a function of the amount of testing, and we projected that forward to look at what would happen if the amount of investment was increased. And this chart shows you what the situation would look like in that Australian state, in Western Australia. So they're currently doing 8,700 random drug tests per annum, representing about just over 0.5% of their licensed drivers. Starting from a base of 0.48 or 48% of their driver fatalities having an impairing drug. So if the amount of testing was to be increased, say to 20,000 tests, our estimate was, following those relationships I showed you before, there would be a reduction in driver fatalities of some 15%, representing a social cost to society of about 149 million per annum, versus the cost of the additional random drug tests of 1.62 million, and you can see that that expanded program has a very high benefit cost ratio of about 92 to 1. There's also a question of expansion at the margin, so the marginal benefit cost ratio is perhaps more relevant. And what we found there is that the amount of testing could go up to something like 10% of the driver licence population before the marginal benefit cost ratio would fall to approaching 2, and that was a safety margin to suggest that it would still be cost beneficial. So our conclusion was that random drug testing has the potential to achieve very significant general deterrence of drug driving in a similar way to best practice random breath testing. It's highly cost effective at the levels of testing currently carried out in Australia. It was mentioned earlier by Philip that the Victorian government has recently funded an additional 50,000 random drug tests to be carried out in Victoria per year from a base of a current 50,000, and they're investing some 4.3 million to do that. And that's about $90 per test, so it's quite consistent with the estimates we've made. But it could go further, and I think the analogy with random breath testing suggests that it will remain cost effective up to about 10% of licensed drivers per year. But to go further, I think we do need to look at improved technology to either make the testing much cheaper or more efficient before it can go further. But I think we should be confident that, like random breath testing, random drug testing can be very effective. How am I for time? Good. It's not all neat in the state of Denmark or Victoria. We do have a situation since the analysis that I described where the random drug side testing has been expanded to include target testing by the highway patrols as well as random at buses. There's a clear aim to do detecting and drug drivers and to specifically deter them by catching them and punishing them. But I think it is also recognised that some drug drivers have to be detected in this way because there may be a limit to the general deterrence that can be achieved by random drug testing. And you can see, if we extend the graph I showed you before, that under this new regime, while the number of screening tests has accelerated, in fact, the initial data suggests that the random drug problem, that the drug driving problem amongst killed drivers has turned around and is increasing. That may in fact be due to other factors as well.